In June, we shined a light on two changemakers reimagining what's possible in healthcare. One with the power of story and data, the other by rebuilding trust in hospitals from the ground up. Galindo is a data communications coach and patient experience advocate with over 30 years of experience in nonprofit volunteer administration. Currently, she runs her own data storytelling, learning, and development company to help leaders empower themselves to communicate more effectively with data. Her work integrates business analysis and communication to help organizations achieve measurable outcomes. Roseanna, please tell us a little bit about your work.
Thank you so much, Denise. I really appreciate your introduction of me. When people introduce me, I'm always like, gosh, it sounds like somebody I want to meet. I have returned to really teaching communication and really focused on helping people, specifically in healthcare and nonprofits, but there's that subsection of where they happen together to find and communicate the story and the data more effectively. What I have found is data is intimidating to some people, and we know we're awash in data. Healthcare, like every ecosystem, is inundated with data. And we don't tend to move people. I like to say numbers numb, stories resonate. It doesn't move people to act. Stories people tend to find meaningful. So with Data Storytelling Essentials, my goal is to create practical, brief and breezy, but very dense and meaty training.
So, Sam Khozin is a healthcare entrepreneur and former internal medicine resident who develops innovative claims analytics software while actively seeking to acquire and revitalize struggling rural hospitals. He specializes in collaborative decision making processes and communication techniques drawn from high stakes negotiation, with a focus on removing artificial barriers that prevent healthcare teams from delivering optimal patient care, and is passionate about creating transparent, physician led healthcare environments. Sam, I'm looking forward to hearing what you have to share.
Thanks, Denise. I appreciate that. So, what I'm all about and my company is all about is really transforming hospitals and rebuilding trust with the patients, with us. If any one of us had a loved one in the hospital today, would we neatly trust they're receiving the most effective, safest, and most compassionate care possible, especially without going broke? So, my partners and I, our mission is to operate and transform hospitals into national leaders. When it comes to rural hospitals, especially, many of them are vital to their communities, and their decline is often preventable. So our goal is to really help stabilize and revitalize these institutions to help them thrive and help their communities thrive. And our ultimate goal is to acquire hospitals, or at the very least, we don't have to necessarily acquire them. Our goal is to operate them. Why are we looking to do that? Well, we want to create the best damn healthcare system anyone's ever seen, because we're all patients.
Want to learn more about these two changemakers? Watch Rosanna's and Sam's full Shine a Light features, now available in the HRC library.